Hi, this is Dr. Divakar Bhat, a cardio-thoracic and vascular surgeon practicing at Aster RV Hospital J.P.Nagar, Bangalore. So I encounter a very common question, what are the heart problems, and in that what are these valvular problems? When do you do valve repairs, when do you do replacements, all those things. So for this one should know what are the valves, what do you mean by valves. Though heart is called as a muscle mass, it's not so simple organ. It's a very complex structure and very much engineered by the God for so many centuries. And this has got a valves. They are nothing but delicate structures inside the heart between the chambers. Their duty is to allow the blood flow in one direction. They are like security guards. Whenever you see a security guard, he will allow people to move in one direction. The same way, these valves are working like a security valves, security guards inside of the heart. They allow blood flow from one chamber to another chamber. If they don't allow sufficient blood flow in one direction, then we call it as stenosis or obstruction. Instead of that, if they allow in reverse direction also, then we call it as valvular leakage or regurgitation. So for all these things, we have a solution, and these valves can be affected by so many diseases: rheumatic, degenerative, infective, or any tumors. Rheumatic is nothing but when somebody gets a throat infection during childhood, it leads to a cross infection to the heart valves, and these heart valves can go either into a obstruction or a leakage. Same way, degenerative, it is nothing but an aging process. As we go on aging, these valves will have a wear and tear effect, and they can have obstruction or regurgitation. That is called leakage. Infective endocarditis is nothing but infection of the heart, which can specifically affect the valves and lead to a damage of the valve. There are certain tumors and certain myxomatous diseases which can affect the valve in a similar way. The detection of these heart valve problems is most of the time patient will come with some sort of symptoms saying, I have a difficulty in breathing, I cannot do my routine day-to-day activities. And when such person approaches the doctor, our duty is to examine him. So we first listen to the patient, what are his complaints, and accordingly we investigate. We do certain tests. The commonest test when we do as a doctor is using a stethoscope and hear his heart sounds. This is one of the easiest way. We call that as murmur, and most of the heart valvular problems can be detected by using a simple stethoscope. Then the confirmation of this diagnosis is by a scanning of the heart, that we call it as echocardiogram. Every one of you would have heard about that. Very simple test, no pain, just from outside we use that machine and identify the valve. Exact anatomy, we will tell exactly how much is the obstruction and leakage. Accordingly, we can either give medicine or we suggest them a balloon valvotomy. And if all these things fails, we do a repair of the valve or replacement using a metallic valve or tissue valve. So at Aster RV Hospital, we have facilities for all these things of detection of these valvular problems and treatment for all these things in a very effective and efficient way. Thank you.